Hi, everyone. I'm so happy to be here. My name is Chelsey Gomez. I am from Florida. I am just turned 33, and I have a daughter that will be turning 8 this year. I am a professional artist. I own my own cancer awareness brand named Oh You're So Tough. So I'm really excited to be here, and thank you for giving me the opportunity to share my story too.
I'm a mom of 3 kids, proud mom. They're my best teachers in this world. They're so incredible. And parenting them through cancer, through medicine, has been very interesting, always exciting. Our house is never boring. I love jogging. I love painting. I love playing guitar. I've also recently become an enthusiast of ecstatic dance. I don't know if you guys have heard of this thing, but it's basically like a nightclub, but during the day, no booze and kids are allowed. And it's just like freestyle dancing. And I'm loving that because I used to dance more kind of officially and growing up. And then lately I've gotten back into it just as a way to connect with myself and my body.
Great, that was awesome. Let's talk symptoms and the diagnosis and a little bit about that first treatment. So Sam, we'll start with you. What was your experience?
I kind of wasn't feeling right. Like in hindsight, it's interesting to go back and piece things together, but I just sort of felt this vague sense of like, I'm tired. I don't have enough gas in my tank, but I was still running like 10 miles on the weekend, like long training runs, but kind of coughing a lot. So I was tired. I didn't have the steam for my usual level of physical exercise. I was coughing a lot, particularly at night, but I also, there were a lot of California wildfires at that time. I just thought, oh my gosh, it's the air. And of course I'm tired because every parent in COVID is tired with their kids doing homeschooling, and it's just a whole different world. And then being a doctor in that time was very hard. But then I got a rock hard lump that just appeared above my collarbone. It was rapidly growing, it was painless, and it was rock hard. And I knew as a doctor, okay, I have cancer. It was just, boom. And there was a little bit of time there that transpired from those symptoms to getting the actual tissue diagnosis. I had to get biopsied. And, first, a lot of people probably start off maybe like I did, where you get a scan and the scan says a lot of scary things that it could be. Like mine said something about possibly metastatic lung cancer or breast cancer. They weren't sure, but I needed to get a tissue biopsy. So I got a tissue biopsy. And then once that came back with as Hodgkin's lymphoma, I kind of knew what the path ahead would be because right around the time when I was diagnosed in 2021, it was right before this big change that started happening with all this immunotherapy and stuff, but it was just sort of the standard of what had been happening for a really long time, which is a medicine called ABVD, or a combination of 4 drugs. So I got a port thrown in on the eve of my 30th birthday. They sang me happy birthday in the operating room as I got my port put in. And then I started ABVD, and I did that there was a question about my staging, whether I was stage 2A/E or stage 4, because there was some lung infiltration. So long story short, that meant that I was going to get 6 months of ABVD. And after a month or two, the coughing went away and I started feeling better. And then my cough came back at about month 2 to 3. And then we thought, oh gosh, maybe that's bleomycin, and I'm a runner, and that's very, very bad. And so we ended up dropping the bleomycin, and I continued on AVD alone for the remaining 4 months. And coincidentally, it was really cool because there had also been a trial around that time to say that that's okay. That de-intensification of therapy, dropping the bleomycin, sort of became like a standard thing if people got a scan like I did after a couple months that showed that body's responding and la la la. So my PET scan after 2 months looked really good, like my cancer was responding and I was having that cough. So we dropped the bleo, and then I did 4 more months of AVD. And boy, was it hard. It was really, really hard. I had a lot of side effects, and I struggled a lot. And I struggled with that feeling. I hear people say things a lot about certain types of cancer, particularly Hodgkin's, like, this is the good one. It's the cancer lottery. And it certainly didn't feel that way. It felt really hard in my life. So anyway, I could go on and on, but that's sort of the beginning
Yeah, so I was first diagnosed with Hodgkin's in 2018 when I was 28, and I was working a lot of hours. So I was very tired, just like Sam mentioned, but I didn't think much of it. I had weight loss without, well, I was trying, I was on Weight Watchers, but it never worked before, and then just suddenly started working. I had shortness of breath, and then at one point I almost crashed my car because I had a vertigo episode. So I ended up going to the doctor, and they told me it was just stress. And the only reason I got diagnosed with Hodgkin's was I eventually had a lump come up on the base of my neck on the left side. And I went to the urgent care. They told me that I just needed antibiotics, but there was something in their eyes that told me that wasn't all I needed. So eventually my family forced me to go to the ER, and we got a full biopsy done. I was in the hospital for the first time. And then, long story short, I had stage 2 Hodgkin's, and I also did ABVD. And about halfway through, we had to drop Bleo because I had toxicity. Yeah, so, and then I was re-diagnosed with Hodgkin's in 2019 as well.
Well, we appreciate it. Without voices like yours and Sam's, we wouldn't have the platform that we have today. So now let's get down to business here. And Dr. Matasar, we're going to start with you. He's the chief of the Division of Blood Disorders at Rutgers Cancer Institute. He's been a medical oncologist specializing in lymphoma for more than 25 years and leads clinical trials to try and find new and better ways to treat diseases like Hodgkin lymphoma. And the first question is a very simple one. It's very broad too, which is, what is Hodgkin lymphoma?
What I would say is that Hodgkin lymphoma, first of all, is a lymphoma. Okay, so what the heck is lymphoma? Lymphomas collectively are types of cancer. They're cancers of cells called lymphocytes or immune cells. So lymphomas collectively are cancers that come from and are of the immune system. That's not to say somebody who has a lymphoma has a bad immune system, far from it. And in fact, most people diagnosed with Hodgkin lymphoma have perfectly fine immune systems. They're not constantly sick with infections. But for whatever reason, some cell mutated or changed in a way that makes it live too long and start making copies of itself. And those copies live too long and they copy. And the copies copy and they copy. And then compounding that, your body sees these cells that are copying that don't belong there, and it views them as kind of like foreign or not right. And much in a similar way to an oyster that has a little grain of sand in it, it starts making a pearl around it. The body reacts to these cells and causes inflammation and scarring and all the stuff that it puts around them to try to wall off these weird cells, causing even more swelling, typically in lymph nodes, although that swelling can happen outside of lymph nodes in other parts of the body as well. And it's that swelling that usually leads to people being diagnosed with this type of cancer specific. So when we as oncologists meet a patient for the first time diagnosed with Hodgkin lymphoma and we work through their treatment choices, it's important to understand that there are choices there. But we think through those choices together with our patients and their families, sort of splitting people into different categories as we understand the risk of their disease and the options that are presented because of that. And one first sort of way to bucket people, to try to put people into categories to help think through their choices together, is based on stage. And we talk about Hodgkin lymphoma early stage and Hodgkin lymphoma advanced stage. And people will often ask, what's my numerical stage? And stage 1, stage 2, stage 3, stage 4. We heard from Sam, I think that it was that sometimes it's not even clear to us as oncologists exactly what the stage is. Is it a stage 2E or is it a stage 4? So the staging exercise, which sometimes feels very black and white, can have shades of gray. But we do our best to try to put people into risk categories informed by their stage, and then think through the treatments that we know are best for that stage of illness. For early stage Hodgkin lymphoma, the standard of care remains, for the vast majority of people, ABVD. It's been around longer than I've been a doctor, and I used to have hair when I was using ABVD, so you know it's an oldie, but a goodie, and it still will cure the vast majority of patients. And sometimes we think about radiation therapy as part of that treatment, sometimes not. But ABVD for early stage Hodgkin lymphoma remains the standard of care. For advanced stage Hodgkin lymphoma, we've moved away from ABVD for most patients. And that's on the basis of really powerful clinical research that was conducted comparing ABVD to a program where the bleomycin was swapped out in lieu of this newer immunotherapy called brentuximab vedotin, which is a type of drug called an antibody drug conjugate. An antibody being a protein that binds onto the surface of a cell, and then stapled to that is a toxin. So this conglomerate thing attaches onto the Hodgkin cell absorbs it, and then the toxin is released inside the cell, kind of like a Trojan horse sneaking into the city and then releasing the soldiers inside. And it turned out that this newer program where bleomycin was swapped out for brentuximab, so BVAVD instead of ABVD, these initials are awful. It turns out that the newer treatment program not only got more people into remission and kept them in remission longer, but we now know that it actually leads to a higher cure rate and people living longer and everything good that we want to do as doctors for our patients. And because of this important research, we really now do use this brentuximab plus AVD program as our sort of traditional standard of care treatment for patients with advanced stage Hodgkin lymphoma in pursuit of cure.